Hi, I'm Dr. Bassem McHale, and I'm one of the kidney doctors or nephrologist here at Massachusetts General Hospital. Thank you for joining us for part 2 of our kidney care video series. In the first video, we talked about what normal kidneys do in our bodies, the stages of kidney disease, and the results of kidney failure. We also began to talk about the different treatment options for kidney failure. In this video, we will spend some more time talking about the treatment options for kidney failure, including kidney transplantation, dialysis, both peritoneal dialysis and hemodialysis, as well as conservative care. First, we will begin with kidney transplantation. A kidney transplant is a surgery where another person's kidney is placed inside your body. This kidney may come from a donor who is deceased, or it may come from a donor who is still alive. This can sometimes be a related donor, like a friend or family member, or it can be from an unrelated donor. A living donation comes from someone who has normal kidney function. This person can then go on to live a normal life with their remaining kidney under the care of their doctor. Donations from deceased donors involve waiting on the waiting list, which is often multiple years long. For many patients, from the time you go on the waiting list for deceased donation until the time that an organ is found for you several years later, you may have to go on dialysis while you move up the waiting list. When an organ for you is found, you are admitted to the hospital for the transplant operation. During this operation, your own kidneys are usually left in your body. After the transplant surgery, you need to take special medications that suppress your immune system to help prevent your body from rejecting the new donated kidney. If the process is successful, the new kidney will work to do the normal jobs of the kidney, and you will then be able to come off of dialysis and will hopefully be able to live close to how you did before you developed kidney failure. However, kidney transplant is not a suitable option for all patients. The operation is a significant stress on the body, and so you have to be healthy enough to be able to safely undergo the operation and safely be able to take the side effects of the immune medications. How can you learn more about your options with regard to kidney transplant? Talk to your kidney doctor, who will talk to you about your specific health. If you are a candidate, your kidney doctor will refer you to meet with a specialized team of professionals called the Transplant team. There, the transplant team will do a comprehensive evaluation of your health to determine whether it would be safe for you to undergo a kidney transplant.
Hello, I'm Dr. Wynne Williams. I'm the Associate Chief of the Renal Division here at Mass General Hospital, and I've been a transplant nephrologist here for 30 years. As a transplant physician, my feeling is that the best practice for kidney replacement therapy is to realize the opportunity for a well-functioning kidney transplant. Physiologic kidney replacement via a well-functioning organ increases the patient's sense of control, independence, and well-being. It increases quality of life. Patients can resume a less restrictive diet, and they in general feel that they have much more energy after their transplant has been placed well and is functioning well. If we turn to the option of transplant evaluation, this is part and parcel of realizing the opportunity for kidney transplantation. And at most medical centers, that's commandeered by a multidisciplinary team that's comprised of many members that have transplant expertise that's focused on making sure that patients are good candidates for kidney transplantation and that they will do well after transplantation. Members of the team are the transplant coordinator. The transplant coordinator is responsible for shepherding the patient through the process and the many different layers of evaluation that's entailed in kidney transplantation. You may meet a social worker, a dietitian, a financial coordinator. You will meet a transplant nephrologist like myself, as well as a transplant surgeon, and finally a transplant pharmacist, an individual with expertise in immune suppressive drugs, rounds out the team along with the transplant psychiatrist. The point of the transplant evaluation is that we place the patient at the center of an evaluation process to help patients learn the basics of transplantation and let them understand and know in great detail the journey on which they are about to embark.